Imagine throwing away a wad of cash every week. That's essentially what's happening across Surrey, and it's all thanks to mountains of unused and wasted medications. Pharmacists in the region are sounding the alarm about this growing crisis, and the numbers are frankly staggering. According to Surrey Heartland's Integrated Care Board, ICB, a whopping £176 million is spent annually on medicines, resulting in 16 million prescriptions being issued. But here's the kicker. Approximately 1.2 million individual medicine units are returned unused, costing the NHS an estimated £12 million. That's money that could be used to fund vital services, reduce waiting times, or invest in new medical technologies. Sharn Dev, a community pharmacy PCN lead in Surrey, puts it plainly. This not only highlights the financial impact on the NHS, but also the environmental consequences of disposing of large quantities of unused medicines. And this is the part most people miss: the environmental impact. We're not just talking about wasted money, we're talking about potentially harming our planet. When these unused medications are returned to pharmacies, staff are faced with the tedious task of removing patient details and safely disposing of the contents. This process takes time and resources, adding another layer of cost to the problem. But where do these drugs ultimately end up? Too often, they end up in landfills or, even worse, leaching into our waterways, posing a threat to wildlife. Akash Patel, who runs Trio Pharmacy in Shepperton, highlights the strain this puts on pharmacies. We are using staff time to remove labels and remove the medicines. It's a free service which we're not getting paid for, he explains. There's been an increase, and this is all at a cost to the pharmacy. People need to have more responsibility. Patel even suggests a controversial solution: charging people for returning unused medications. But here's where it gets controversial. Would this deter waste, or simply discourage people from returning medications safely, potentially leading to improper disposal at home? Mr. Dev emphasizes that their scale of waste has become so significant that his pharmacy now requires weekly collections to empty its overflowing medicine waste bin. He recounted an instance where returned items included high-value medications like inhalers and insulin pens, with an estimated cost exceeding £5,000. Think about that: £5,000 worth of perfectly usable medicine, simply thrown away. Linda Honey, Director of Pharmacy for Surrey Heartlands, offers a simple yet powerful message. This is a clear reminder that every prescription matters. When people only order what they truly need, it not only saves money but also helps ensure medicines are available for everyone who depends on them. This highlights a crucial point: over-ordering isn't just wasteful, it can also create shortages for those who genuinely need specific medications. So, what's the solution? Is it stricter prescribing practices? Increased patient education? Charging for returns, as Mr. Patel suggested? Or perhaps a combination of all three? What role do you think patients, doctors, and pharmacists should play in reducing medicines waste? Share your thoughts in the comments below. Do you think it's solely the patient's responsibility, or should the NHS implement stricter regulations on prescription quantities? Let's start a conversation.